Three of them are super important. Okay, your teeth are there for the actual crushing and grinding your food very well. Because if you're not able to crush and grind your food very well, then you're not able to mix it up with a lot of ingredients that is there in your mouth, in your saliva. It is important to mix all the ingredients of your food with your saliva very well, because that will help your tongue and your palate to understand what you are eating or drinking. Why it is important for your tongue and your palate to understand what you're eating and drinking is because it has a job of feeding it back to your brain to say what the hell is going in. All right. So it is so now important that your teeth has to be in great condition at all times to do that action. Now, because your teeth are embedded within your bone, which is covered with your gums, it is just like a building with a solid foundation. Okay, so you might have the most beautiful house in the world, but if the foundation gets wobbly, you know what's going to happen to your house, right? This is exactly what it will be when it comes to your gums and bone. It becomes super important for you to maintain the health of your gums and your bone so that the tooth is stable in its position, the tooth is not getting wobbly, and the tooth has the strength and the capacity to do all the chewing it does. Okay, so there are different things that your dentist says, your hygienist says, and everyone says on how you look after teeth. All right, so basically your brushing, interdental cleaning, mouthwash, and so on and so forth, which I'll come to in a minute. But let me just touch base on what happens and what are the problems you would normally get yourself into if you are not managing your teeth and your gums very well. So if you go to the next slide, this is a slide which sort of articulates what happens with your teeth. Okay, so all of us within our mouth, as well as everywhere in the body, we are filled with different kinds of microbes, bacteria and viruses and everything else, and we coexist. Okay, if someone says, I don't want any bacteria in my mouth, it's just not possible. Okay, so they got to have bacteria in their mouth, full stop, because we always, it's just like someone saying, I don't want any people around me, I just want to, it's not possible. You're going to go a bit mad afterwards. So you need people, but you need to know how to relate yourself to them. So what is the most important thing when it comes to your mouth and when it comes to bacteria in your mouth is you got to consistently keep them very unstable. Okay, you can't keep them in one place for too long. All right, because it's just like human beings. If you are not allowing human beings to be in one place for too long, you're constantly messing around with them. Their only problem is to find a safe place to stay. Right? They're not worried about anything else. They're not worried about where will I build my house. They're not worried about how am I going to buy a new car. They're not worried about where I'm going to send my children to school. They're worried about how am I going to spend this night, because tomorrow morning there is someone else who's going to come and kick me from here. Right? And the same philosophy works for the bacteria as well. If you're constantly kicking them out from one place to the other, you are giving them enough work just to sustain themselves. And that's exactly what you do when you're brushing or cleaning your mouth. You're just causing so much of riff up there that they are kicked from one place to the other. Some of them are washed out, some of them are kicked around, some of them are made to run, some of them are made to do something, so they're not allowed to be in peace. Okay, so then before you come back to them again, they try to stabilize themselves, but you're kicking their butt again. Okay, but don't kick their butt. It's exactly going to be how it's going to be for us being settled in one place. The minute you allow to settle in one place, then I want to go and buy a place. I want to build a house. I want to build a garden, and then I need to buy a few cars for myself. I just want everyone else's house to be mine, right? So this is the way the nature works. Okay, so when you allow the bacteria to stay in one place is when they start to destroy the structure around you. Okay, and because that is their food and that is their fodder. That is exactly what has happened in this illustration where the tooth has been damaged. And the damage is purely because the bacteria want to sustain itself. It's just like you. They also want to thrive and they want to establish and they want themselves bigger. Yeah. So when it goes worse is when we have sensors in your teeth, which are called as nerves or pulp or whatever you call it, which tells your brain that something is going wrong. And that is super painful. All right. They don't just give you a gentle warning. Sometimes they do, which we sometimes ignore. And when they give you a proper warning, you can't sit, you can't stand, you can't sleep. And that is when you come running to the dentist. Okay, so the point of view all through this discussion is don't come to the dentist or the doctor after you have a problem. When do you have to come to the doctor or the dentist? Before you have a problem. Okay, so first thing is get your habits right, get your systems right, understand what happens within your body, and do things to make sure it goes in the direction where you want it to go and not in the direction where other people intend it to go. Okay, so that is the problem with your teeth, which can then be resolved with a filling, with a root canal treatment, with an extraction, with a dental implant, whatnot, which your dentists would be the best people to tell you, suggest to give you options, and you can help yourself in those directions. Okay, going to the next slide. Now, the next component with your mouth is your gums. Okay, and the biggest problem in the society, especially in the elderly population, especially in the population from Africa and Asia, is the gums. Okay, in literature, almost 70% of the world population, the reason for them to lose their teeth in the later part of their life is to do with their gum health. It's the gum that gives up, and it's not the teeth. And that's how critical it is for us to understand gums. Now, what happens to your gums? Okay, the problem with the gums is with your teeth after you're 15, 16 years old, your teeth are not going to change. Okay, they're going to be the same all your life. All you need to do is to maintain them and look after them. Whereas with your gum, the problem is they regenerate every second and every minute of your life. Because they're constantly changing, anything that is happening within your systemic and mental health, okay, which is very, very, very important, not just your systemic health, within your systemic and your mental health, has an impact on how your gum behaves. Okay, plus other factors like how your genetics has been. So some of us are quite weak in our build-up. Some of us are quite strong in our build-up. I keep getting this question, oh, I look after my gums and I look after my teeth so well. Why do I still have problems? Okay. And then there's some other people who would have been smoking maybe 20 cigarettes a day and not having good oral health and oral hygiene, but still not as affected as the other person is who's been looking after themselves well. So this planet or this whole universe is not a fair place where, oh, this is not fair. Yeah, this is not fair. This place is not a fair place. Okay, so there is a level of uncertainty and non-fairness that exists, and we got to agree to it and we got to live with it. So there are some people who are weak with their gums, and there are some people who are strong with their gums. There are some people who are weak with their teeth. There are some people who are strong with their teeth. There are some people who are highly predisposed to diabetes. There are some people who are not predisposed to diabetes. So the whole body makeup is so different from one person to the other. Yeah, and that is why knowing yourself becomes such an important thing. This is another problem we have in the Western healthcare. There is a kind of a one size fits all policy, which we are slowly changing, but has been an issue, which we, especially from the subcontinent, has to understand that it's your job to understand yourself. It's not someone else's job, right? So it's not the neighbor's job to sort out your house. It's your job to sort out your house. So you got to understand that gums can be of different types in different individuals. And this is where the actual education needs to be in everyone within your house and within your population. And this is the reason why they need some amount of help from the healthcare workers, from your dentists and your doctors, to sometimes understand yourself. And the beauty about today is you have so much technology that is very, very helpful to make you understand what you are, how you are, why you are. So it's about trying to get the balance right. Sometimes we are swaying too extreme towards one side, and then other times we are completely ignoring it. It's about trying to get the two together, using technology, using the health professional, using your own understanding about your body and your diet and everything else is the most difficult thing. Balancing is the most difficult thing. Okay, so when it comes to gums, the problem is generally mainly to do with yourself. A person with weak gums have to be super, super, super careful, because what we have not understood very well is gum disease is not actually a problem caused from a stimulant or an external factor. A gum disease is basically a problem related to you and your own immune system. Okay, it's the host response to an external stimulus, we call as. Okay, so if I can give you a bit of an analogy, you see three types of people generally. Okay, there is one type of person whom you can go and make a bit of a fun, pull their leg up a bit, even tap their head. They are calm and relaxed. They don't care. They just are so chilled out. Okay. And then there's another kind of person who's a bit annoyed but doesn't show it so much. But then there's a third kind of person. You don't even have to pull their leg. You just got to stare at them and they will start a fight. Right? So this is where the gums are when you are more predisposed to gum disease. Even a small amount of bacteria, even a small amount of stimulus, even a small amount of something that can irritate you creates such a massive reaction within that gum type that it self-destructs itself. Okay, and this is what is called as gum disease. It's your own self-destruction. And that is why it is very important for you to understand what kind of gum type you have from the beginning, so you are more careful. And unfortunately, in our science today, we still don't have a very robust way of changing the host response. Because we do not have a very robust way of changing the host response, we are always trying to mitigate it by stopping the causative factor, like smoking or alcohol or something. And so we are not allowing. It's just like you're not changing the attitude of the person, but you are trying to avoid that person completely. You're trying to tell everyone, mate, don't go and do anything to him because he's gonna cause a fight. Okay, that has been the way we are treating gum disease. Nowadays, especially in our practice, now we use a lot of laser, because lasers are one of the ways of how you can biostimulate and sort of change the host response to a particular stimulus. Okay, but these are still things in progress, and in a way we are trying to find different ways to sort of work it in a way that it helps people to mitigate this problem as early as possible. Okay, so gum health is very, very critical, because if you go to the next slide, when you lose your gum, or when the gums get into problem, they have a huge link with the rest of your health. Okay, some of the major problems we have is to do with diabetes. Okay, and they are interlinked so much that someone who has diabetes also increases the risk of having gum disease, and someone who has gum disease finds it very hard to control diabetes. Okay, so that's the reason why it is, and they're both genetically quite predetermined. They have a predisposition. People have that predisposition for diabetes. People have predisposition for gum disease. The earlier you know that you are predisposed to gum disease and diabetes, the better, because then you're able to control the causative factors. You're able to change your lifestyle. You're able to be on top of your overall day-to-day life. Okay, how are you going to be maintaining your oral health? How are you going to be maintaining your general health? How your diet should be, how your physical exercise should be, how your mental status should be. All of these has a great amount of influence in the way you're able to sort of manage and prevent a problem from happening. Because both of them, once they happen, it's quite tricky because you don't have a resolution. You are not able to cure it. You're always managing it. You're always trying to stabilize your condition and not make it worse. You got to live with it, right? So it's better to try and stop it before it starts. Okay, so going next to the next slide, which is gum disease and heart problems as well. Again, this is another major thing. So this is why I initially started off saying how important it is for us to understand our body as a whole, because they're all so very linked up. When you have gum disease, there is a lot of systemic inflammation that happens, which does release a lot of inflammatory markers. Okay, and that gets into your bloodstream and it causes a lot of what we call as blood vessel inflammation, and which in turn slowly contributes towards your heart problems or your cardiac problems. It causes it contributes towards shrinking your blood vessels, and then if there is any kind of a fat deposition and things like that, these are the things which goes and settles in there. These bacteria which enter into the bloodstream through your gum disease is the ones that is going to go and then settle in some of these blood vessels, and they start to clog up your blood vessels. It's just like clogging up your water pipe slowly but steadily. It also has been found that the same bacteria that we find within our gum disease and within our cavities are the ones that go and settles on the walls of your heart. So a lot of the people who have any heart wall problems or calcification or things like that, they find the same strains of bacteria that is found in their mouth. And this is one of the reasons why sometimes your doctor, when you have had any heart problem, they recommend that your dentist give you some antibiotic cover before we do any kind of a dental treatment, because their worry is that they don't want that kind of bacterial infiltration into the bloodstream causing more complications. But even otherwise, it's always good to be more careful and not feed these things into the bloodstream consistently. Okay, and it's also, the studies have shown that with severe periodontitis, there's a very high risk of myocardial infarction and strokes due to systemic inflammation and atrial plaque buildup. Okay, as a whole, it's quite connected because the blood that comes in your gum is coming in very close contact with all the inflammation that happens within your gums, and that is where it is very kind of a very transitional environment where things from the gum area can get into the bloodstream, and the bloodstream can start to bleed very instantaneously in this inflammation. So very, very careful in those areas. Okay, so obviously there are risk factors like smoking, obesity, poor diet, and age, and things like that. But again, as I said, there's no one kind of a thing that fits all. We need to be able to understand where we are, what is a predisposition, where are we sort of in terms of our overall health, and then work its way out. This is where a kind of a close interaction with your healthcare professional, maybe it's your doctor or your dentist, becomes very critical. Okay, so coming next to the slide of, this is another big debate which we want to have, is cancer.
Kaushik, sorry.
Yeah.
I'm wary of time. We have 12 minutes to 7,
Hmm.
and we will extend this webinar by another 10 minutes. I'm sure a lot of people have burning questions to ask you. Is it what posted a while? And because I can see some questions in the chat. Maybe we could address those questions. Then
Yeah.
You can carry on. I hope that is okay with you, Kaushik.
Yeah.
Okay. So, Hadi, do you want to call out the questions, please?
Some of the questions we have here, one of it is electronic or manual toothbrush. Which one is more effective in cleaning teeth? Which one do you think?
Again, as I said, see, the reason why we have gone electric is, say, it's like asking me which one is better, a manual car or an electric or an automatic car. Okay. If you ask a Formula One race driver, the guy says, I want a manual. I don't like electric because I want to control my car. If you ask me, I say I want an automatic because I don't want the hassle of me controlling the car. I want the car to take me from A to B. Okay, so the same thing with your toothbrush. Your toothbrush is only there to make sure it goes everywhere and thoroughly cleanses everything. I think the thing is, when my parents used to say, brush hard, okay, so you just had to go and give such a big brush that a brush has to be changed every month. But that is not how you brush your teeth, all right? It's just like me asking my staff to clean the glass and say clean hard and then give them abrasive. The only thing they do is they scratch the glass. They don't clean. You got to dust the glass. You don't have to scratch the glass. And this is the problem a lot of us have with manual brushing. We put so much force and we don't do the brushing very well that we damage our teeth and our gums more than we clean them. To overcome that problem is where we try and motivate more and more people to go electric because it does the job for you. All you then need to do is to hold the brush and the brush does it for you. And it also has kind of a sensors in it. If you put too much pressure because, I don't know, you're angry with your partner or you woke up too early in the morning, I don't know what happened in your life, you're going to be putting all that sentiments onto your toothbrush. Yeah. And that is the problem number two. So these brushes are with sensors. So it starts to flash light the minute you put too much pressure. Right? And then you say, oh, I relax. This is the reason why they say electric toothbrush is better than manual. But if you know how to handle a manual toothbrush, amazing. You should be able to handle a manual toothbrush.
Yeah, thank you very much for that. Another question is about the active agents. Is there any form of active agent that one should look for in toothpaste when buying them? Is there any form of active agents that you think would be relevant?
It's a very controversial subject, okay? But because with research every time we come with something and then something else works not so well. So Fatia is the best person because they are the ones who do this clinical research all the time and tell us, "May you're not doing things well." We used to say that some amount of fluoride in your toothpaste is one ingredient that helps because it's anti-caries and it creates a less chance of cavities within your tooth. Okay, that is why a lot of the adult toothpaste comes with some amount of fluoride in it. However, there is a bit of a discussion that they should not be using fluoride and things like that. They're gone too biological now, but it's kind of a concept that you need to look into and see. But as a whole, within the dental fraternity today, we do still recommend have some amount of fluoride within a toothbrush. Also, if you have gum problems and gum disease, there is a component which is called as chlorhexidine, which is a bit better in terms of maintaining your gum health. And so we do recommend toothpaste which has a bit of a chlorhexidine in it as well. But you got to again take the advice of your dentist because chlorhexidine tends to stay in your teeth. And I don't want people to message Fatih next time like, oh, Kaushik asked me to use a toothpaste and now my
All right.
you take advice because it has to be a bit customized to your needs and requirements. Okay, but at all, the normal toothpaste that you get in your shop is more than enough. Okay, it has a bit of a fluoride in it, it has the lubrication in it, and that's all you need to brush your teeth.
Yeah, thank you for that. I would like to join two questions together because they are concerning the gum, which does gum disease has genetic links? And there is another question which says, is gum disease related to being anemic? If you could just juggle the two together and see the question.
I think I answered the first one that it is genetic to an extent. to an extent, you have a predisposition. Some of us are unfortunate to be more predisposed to gum disease as compared to someone else. Anemia, to an extent, there's a lot of side effects of anemia, right? And probably gum disease would start to become a part of it, depending upon how uncontrolled it is, how aggressive it is, how severe it is. Now, you can't have a direct correlation of anemia to gum disease. I don't think so, but there is some amount of effects of anemia on all parts of your body.
Okay, and we have one which says, how can I eradicate blood stains when brushing, please? And someone asked about drinking water before brushing in the morning. So one about eradication of
You can. That's the whole reason why you need to see your dentist, have a good test, see why it is bleeding. There is a lot of reasons why gums can bleed. There is local reasons where there is inflammation within your gums because of external stimuli like bacteria or fungus or things like that, which is why it is bleeding, or food impaction. Or there are sometimes systemic problems which also makes your gums bleed. Okay, we always say your mouth is a mirror of your body. A lot of the times, a lot of the diseases that is there in your body have some kind of a symptom within your mouth. So there is always a lot of symptoms of other systemic diseases, and one of the symptoms is gum bleeding. So I don't want to scare you off saying, because people directly catch that, okay, you have this, that's why you're bleeding, then from tomorrow they'll be super scared. No, gum bleeding is normal, and you just need to see the dentist and find out what could be the reason why it is bleeding and what is a very good solution, and then that's it. Find a solution as well.
Thank you, Doc. And about the drinking of water before brushing in the morning, is that recommended? Or?
Yeah, if you're thirsty, you can start off drinking water. It's no problem, but I don't think it makes any big difference from one to the other. You drink water before or after. It's your personal choice. I don't think it makes any difference to your oral cleaning.
All right. Would you say, which one would you recommend? Hard, medium, or soft brush type? And then someone asked about how often can we change brushes.
Yes, as I said, soft brush. You don't just imagine thinking, okay, you're cleaning your glass. You don't want any abrasive there. Right? You're dusting your glass. Okay, so you're brushing with the softest toothbrush possible. That's all you need. You don't need any hard toothbrush. Okay, anything that you can't remove with your soft toothbrush, only your hygienist can remove. You can't remove it anyways. So don't try too hard doing it. Yeah. And yeah, it's a kind of a wear and tear process. Between like 2 to 3 months time, if you're able to change a brush, that would be better. Okay, in a way. I can't put that, as I said, it depends on how the brush is, what kind of brush, and then how much of deformation happens and things like that. But say give yourself about 3 months and then change the brush, that would be ideal.
Okay, thank you very much. And then we have a question about food crush, because you mentioned it in the presentation. Like, tell us about it as well, because some of African food we have to swallow it. So what happens if the food is not crushed and mixed with saliva before being swallowed?
Yeah, it's okay. The thing is, I can't, you can't take word to word and then try to follow it. It becomes a bit too hard in life, right? So even some of the Indian foods you need to follow, and then in a way your body is quite well equipped to, even while you're swallowing it, gets a good idea of what kind of food it is. So it's not that you got to chew, but you basically getting an understanding of why your body is made the way it is made.
Yeah.
Okay. As long as you don't swallow the whole burger, it's okay.
Yeah. Yeah. Someone said there seems to be a teeth whitening pandemic for fashion reason mostly. I read somewhere about the side effect of teeth whitening, and one should go for scaling and polishing as an alternative. What are your thoughts? Like,
Okay. See, teeth. There are two types of stains on your teeth. Okay, there's something called as extrinsic stains, and there's some other things which goes intrinsic, which goes into your teeth, because there is a enamel, which is your top layer of your teeth, and enamel is like glass. Okay, but your food that you take, it can have a lot of acid in it. Lime, vinegar, fizzy drinks, even fizzy water, or wine, all these things have some amount of acid. And when you keep flushing your teeth with acid, your teeth keeps getting porous because the enamel becomes chalky. It's like a chalk surface. So it consumes more and more stains into the inside of your teeth. That is why your teeth keeps getting darker and darker with age. Okay, so when you go to the hygienist, they are able to take out the stains from the surface, but they are not able to go deep into the pores and then take the stains out. Okay, so they need a way of taking the stains out, and so that is where we use a process of nascent oxygen to suck the stains away. But the problem is you got to be an expert to do things, all right? But now everyone wants to do teeth whitening. Your hairdresser wants you to do teeth whitening. They say, you do your hair, we'll give you free teeth whitening. Your Costco, when I go to Costco, they sell me teeth whitening. The problem with those ones is they're chemicals which are able to take the stains away, but they're not treating the porosity in your teeth. Because they're not treating the porosity in your teeth, your stains will go away, but you will be suffering with a lot of sensitivity and pain. And you come running to the dentist saying, oh my God, I can't eat, I can't drink, I can't do nothing because my teeth hurt a lot. All right. So there are ways which your dentist should generally know. For instance, in our practice, we don't do teeth whitening. We do something called as teeth rejuvenation, teeth enamel rejuvenation. So we take out the stains, but we also recondition the enamel. So that way it strengthens up the enamel. It makes you look nice and beautiful and white and everything else, but also it makes sure that your teeth are also well managed and made stronger.
Okay, thank you, sir. And how effective is African chewing stick, please?
African, what is that? Sorry, I didn't get that.
Chewing stick. There is something we call chewing stick. It's just more like a
Papo, Kaushik.
yes. So it's a kind of a stick that we use to brush our teeth in Africa.
Yeah. We see, the thing is, as I said, getting the balance right. Okay? As much as we can't go too extreme on technology, at the same time, we can't go too extreme on our grandmom stories as well. So you got to bring the balance somewhere in the middle, where we are using the best of my previous generation and the best of my present generation. So you get the balance right. It does the job. If you forgot to take your brush to your holiday when you go to Africa, and then you have option of not brushing your teeth or a green stick, then probably green stick is going to be okay. But if you have a toothbrush, I prefer the toothbrush. That's what I would say.
All right, I'll just take one question from the chat box, and then someone is raising. Oh, I think we lost the person.
I'm just wary of time. We have 8 minutes to end this. I'm really interested in oral health and cancer, and I know Kaushik still has some other slides to put us through on. Just a quick update. If you have burning questions, the WhatsApp community is a great place to post your question. All I need to do is to forward to Kaushik, and I'm sure Kaushik, I hope you'll be able to attend to all these questions. So you just need to note down your questions. We're wary of time. We have an extra 10 to 15 minutes, but I really want to hear what Kaushik will say about oral health and cancer. If we have more time, we'll address more questions. Other than that, please feel free to post your questions on the WhatsApp group. Thank you.
Okay. Lovely. So that's interesting. Nice. So oral health and cancer. So basically cancer, what is cancer? Cancer, from my laymanish way of explaining things, and I won't go into too much science here because there's a lot more scientists on the screen who can explain things better than I can. All right. But from cancer is basically an exacerbated growth of rogue cells within your body. Okay. It's just within a society. A society is considered healthy where there are more people who follow discipline and regulations and less people who don't follow it. Okay, then the society is called a good society. If the people who don't follow it becomes more and the people who follow regulations less, then it becomes a unhealthy society. It becomes a sick society. It becomes a suffering society. That's exactly what happens within your body. We always have some cells within our body which will forget their what we call, I call it as cosmic principles. So everything within this cosmos work on certain principles. Okay, the earth literally goes in a particular way, in a particular speed, in a particular direction. That is why it is in its orbit. If it starts to say, hey, I don't like it anymore, I want to just go to wherever I want to go, it's not a planet anymore, right? It's gonna go and crash somewhere, and we are not going to be on the planet either. Okay, because it follows the discipline the way it follows it is why we are where we are. In the same way, the whole cosmos works, and within the cosmos, even our whole cells work. My skin, if it starts to say, oh, I don't want to keep growing skin anymore, I want to grow a bit of a heart now because I don't like to be skin all the time, it starts to create a bit of a problem, right? And this is where the rogueness happens. And within our body as well, this kind of rogue cells, we have a very nice way of removing the rogue cells on a consistent basis. We do produce, all of us produce some amount of rogue cells, but we have a very consistent way in our body to remove it. The problem happens when our lifestyle and our imbalance in lifestyle is going to shatter that system of balance, and now you're starting to make more and more and more rogue cells, and their number starts to increase, and this rogue cell is what is called as cancer. Okay, so from the oral health point of view, when there's any chronic inflammation within your gums or in your mouth, they do create a lot of what we call as inflammatory markers, and these can promote tumor growth and metastasis as well. Okay, number one. Number two, there is the imbalance in the microbial flora itself within the mouth can also be a reason why you can have cancer within your mouth and your throat and all those areas pertain to your mouth. Okay, even viruses for that matter can also be a reason for a lot of what we call as oropharyngeal cancers. Plus habits like smoking and alcohol, again, they're doing the same thing. They are constantly irritating your cells, where the cells are slowly starting to forget their identity. The cells are starting to lose their kind of a memory, and they start to completely go rogue. And a rogue man has no principles. They drink in the morning, eat in the afternoon, party in the night. There is no time for them, right? And that's exactly how the cells behave. And when that starts to happen, then you lost control. Okay, but also the other issue that we see is some of the bacteria that is found in your mouth and in periodontal or gum disease. We see that they have been associated with cancers like the cancer in your digestive system and even cancers in your pancreatic cancers. One bacteria, which is the Propheromonas gingivalis, we call, which is a very major bacteria in your gum disease, is also associated with some of the pancreatic cancers in some of the studies. So there is a huge amount of correlation with inflammation that happens in your mouth to your chances of having tumors elsewhere, number one, or in the mouth itself. Number two, that you need to know the relationship between cancer and oral health is any treatment that you have for cancer has a direct impact on your oral health.
Mm.
So if you're having any chemotherapy or radiotherapy or immunotherapy, any of those things, the way we have our science is right now is we treat cancer. I would probably go on for an hour just explaining this cancer, but to give you a very small, Fatima says she's going to go home, so I'm going to make it very small. So the reason how we treat cancer is we hit at all rapidly multiplying cells, basically. Okay, because we hit that, because cancer is very rapidly multiplying. And that is what we try to hit at. But because a lot of the cells within our mouth, like what I explained to you, the gums, the cheeks, the tongue, and everything else, are also rapidly multiplying, they get affected when you treat cancer. And the minute they get affected, your whole oral imbalance happens. So now you are not able to eat. Your tongue can't feel any taste. You have a huge burning sensation. The saliva flow is very low. You're starting to have slightly drier mouth. So what that does is it makes you not to eat. It takes off nutrition. The minute you don't eat, you go off nutrition, then your body is not getting the nutrition it needs to fight. It's already fighting a problem, and it's again been blasted with chemicals to cure a problem, and now you're not able to give it enough nutrition. So it just complicates things, and that is where you got to be very careful when you're trying to sort of have this treatment. You also have to consider how you deal with this with your dentist as well, and it's always better.
Dr. Kaushik, sorry, just to intervene there for a second. So if you could wrap it up within the next 5-6 minutes, that would be great. Because we've already got
Yeah.
few minutes
So that is the reason why your cancer is a problem for the mouth, and the mouth is a problem for your cancer. So see your dentist or anyone with your relatives who have cancer, try to sort of make sure you be in connection with the dentist. Okay. So the next one. So that's more or less it. So I think I've given enough information, and I think you understand what is the main reason why you need to see your dentist. You need to have not only your car MOT'd and serviced, you got to get yourself MOT'd and serviced. And that is where the dentist these days, especially in our practice, we go far above in trying to expose what we call as biofilm, make sure everything is thoroughly cleansed up, any acidity in your mouth is removed. You made sure that you are given enough education to look after yourself. Okay, so going and if you do that, relationship with your dentist, some of the things you see in the next slide is something which doesn't give you any pain. You see those dark areas below your teeth, we call that as hotspots. These are infection that is consistently there within your body. It is not giving you any pain, because a lot of the times patients come to me, I don't have any pain, I don't think I need to come. The problem is you're brewing a poison within your body, and that poison constantly initiates immune reaction within your body, and that constant immune reaction will slowly make your immune system tired, and there's a very high chance that they are going to go against you. And that is why we have a high amount of immune related problems, autoimmune disorders, allergic reactions. All of these are associated with things which we don't know, which we are brewing, and that is where you need good amount of health care advice and investigation at consistent basis. Okay, and also the other thing in the next slide, you see that when you have these kinds of healthcare checks on a consistent basis, you're able to find things which still hasn't caused a problem. There's a calcification where the green circle is on one of your major arteries, which goes to your brain. And these are the reasons why a person can have a stroke, for instance. Okay, if we are able to diagnose that early, then we are able to prevent a problem from occurring, because when the problem occurs, it can be very late for us to give you a solution. Right? So going to the next slide. I basically want to tell you that a healthy body and a healthy mind, I think we explained this enough. So you need to understand a healthy body, healthy mind works together. All right. So for you to be happy, you got to have a healthy body. And if you are happy, it's easy to maintain a healthy body. Okay. And so going to the next slide. This is how I like the relationship to be with the patient and the dentist. Both are smiling, both are happy, both are chilled, both are relaxed. There is no much agony or anger happening between them. And the reason for that is the doctor's job is not to treat you and look after you. Okay. The doctor's job is, if you go to the next slide, is to help you look after yourself. Okay, we are just a guide. We are just there to educate you and give you a better understanding of what you should do, what you are, and how you should look after yourself. And the basic criteria is to understand your body, have a balanced diet, understand what a healthy lifestyle is for you, and then make sure you have consistent checks within your system for your health. If you can look after your car and look after your dog, you probably can look after yourself as well. You don't want someone else to look after you. So hopefully that would more or less summarize the discussion for today. And obviously, yes, the details of me and my practice is always there. We are always there to welcome you and help you. If you need any help, please feel free. That one you can sort of scan the code there. It gives you all the details of the practice and our website and our reviews. If someone likes what I've told you today, you might give us a Google review and say, okay, it makes some sense. Yeah, if you have a problem, we're always there to help. Thank you very much for your time. It was very, very nice and amazing to be associated and see the numbers who are coming today to share their experiences. Thank you very much.
Thank you very much. That was a great presentation. Please, let's try to switch our camera on for the group photo whilst we do some other things on the... Alosh, what do you think?
Yes, it would be great if everyone could, before we go, switch on their camera, and then we can take a screenshot of all of your smiling faces. So I'll do that now. And thank you so much for being here. I know we ran a bit longer because of some technical problems, but it was an incredibly, very, very helpful presentation. And thank you so much for Dr. Kaushik for that. And I know that we've got so many other questions as well, but please use the WhatsApp community to do that, to ask those questions, and then we will go back to Dr. Kaushik and get you the answers for that. Our next webinar is on the last Tuesday of February, which is the 20.
Do you want to share your screen? Just also to mention that Dr. Kaushik is on the WhatsApp community, so please feel free to post your questions there. I'll forward it to him privately. If you want some form of anonymity, you could send that your private questions to any of the admin members. We have our next webinar on the 26th of February. This time around, it will hold on a Tuesday at 7 to 8 p.m. based on your time preference. And yes, sorry for taking up your job, Alosh.
And we could have the feedback, the code just for people to help us, the feedback on today's webinar, please. And more, you can post your questions on the group just because we are running out of time already, so that it can be attended to. Thank you very much, everyone, for joining us on this webinar.
And thank you so much, Dr. Kaushik, for being here and for such an incredible presentation.
Thank you. Thanks, everyone.
Thank you for the presentation.
Yes.
Yeah.
Your feedback will be important as well, everyone. Thank you.
Bye.
Thank you.
Thank you.
Bye.
Thank you.